Hello, my name is Oderic Uzuma. Today I have my good friend Xandra with me. She currently is feeling some pain, and we're just gonna ask her a couple of history questions just to see what's going on. So tell me, do you play any sports?
Yes.
Yes. And what sport would that be?
Soccer.
Soccer. So when you were playing this sport, did this injury occur like when you were, say, kicking the ball and extending your knee?
Yes, actually that's exactly what I was doing.
That's exactly what happened. Okay, so do you feel like, does your knee feel like more unstable?
Yes, it's very unstable.
Very unstable. And when you're walking, would you say there's like a lot of pain, like, or?
Yes, I can't put any pressure on my knee.
Okay. And is there swelling towards the knee? And which knee is it?
Yes, there's a little swelling in my left knee.
In the left knee right here?
Yes.
Okay. Besides that, lastly, when you were kicking the ball, or like when the injury first happened, like the initial onset, was there a loud popping sound, or?
Yes, there's a loud popping sound. Everyone heard it.
Okay, so from what I've gathered, I believe that you actually have maybe an anterior cruciate ligament tear, or an ACL tear, as most people call it. So we're gonna do 3 types of tests to just confirm. So the first test you want to perform is called the anterior drawer test. Upon starting, you want to make sure that the patient's hip is at a 45-degree angle. Now, getting the affected knee, you want to take it to a 90 degrees angle, and to fixate it, all you have to do is sit on it slightly so that it won't move anywhere. Now, get your 2 thumbs and palpate the joint line right here, and then give it a slight tug towards yourself. Now, if it moves more than 6 millimeters, or at least 6 millimeters, or there's like a squishy feel, that's how you know that this is a positive test for the ACL tear. So the second special test we were performing is called the pivot shift test. In the pivot shift test, you're gonna make sure that your patient is at a supine position, and with your right hand, or whichever one is closer, you wanna grab the calcaneum and lift it to around a 30-degree angle. With your other hand, apply it to the lateral side of the knee and internally rotate the leg. With the slight valgus force, go from flexion to extension. Now, a positive test for this is when the tibia jogs backwards or reduces from 30 to 40 degrees. And this is due to the tightening of the iliotibial band. So to start off this workout, so to start off this special test, you're gonna first make sure that your patient is in a supine position. Then grabbing the affected leg, you're gonna flex it to a 30 degrees angle. Upon doing that, you wanna fixate the femur with your outer hand, and with your inner hand, externally rotate the knee. Now, give it a slight force towards yourself, and then you'll be able to tell if it's false or negative. A positive test indicates that there's a squishy feel at the knee, and or if there's a tibial translation towards yourself from 3 millimeters in comparison to the unaffected leg. So doing all the tests, I have determined that she does in fact have an ACL tear, and surgery will be required. After surgery, physical therapy and cold compressions will be the first things you do in the first few weeks. And physical therapy will increase in regards to intensity as you begin to heal. And we hope for light walking within a month, something around that. But at the end of the day, lastly, it's a serious injury and it takes time to heal. So you most likely won't be at full mobility until, or on average, around 6 months.
Okay, thank you.
Mm-hmm.